Hello, hello, it's Beth Wright, and I am doing your podcast for Chapter 60. This will be talking about disorders of the skin, and this is NUR 237, Unit 5, your last unit. Okay, so we got the exemplars that are listed. So we've got the dermatological medication drug classifications, such as antibacterials. We have combination products there that have different antibiotics, different types of medications included in that. We have antifungal agents, antiviral agents, and we have the retinoids, the isotretinoids. All right, so we got inflammatory conditions that can occur with the skin. And we often hear this called dermatitis. That's a generalized term. And we see erythema, which is, the redness, pruritus, which is the itching, and of course lesions of the skin. And it can be a chronic or an acute type of thing. You may also hear this called eczema. And again, it's noting an inflammatory response of the skin, and it can be due to injuries from irritants, allergens, or trauma. You may also see atopic dermatitis as a diagnosis as well. It's a common disorder characterized by dry skin, pruritus, and lesions, and that can be caused by exposures to allergens, irritating chemicals, foods, and even emotional stress. There's contact dermatitis that results from direct contact with irritants, and so that could be like soaps or detergents, or it could be allergens, so different clothing materials or dyes, jewelries, cosmetics that can stimulate inflammation. And then we can also see the seborrheic dermatitis, which is a disease of the sebaceous glands, and you see an excessive production of sebum with this. We can also see drug-induced reactions, as you know, and that can occur with any drugs. So you usually see the urticaria, which are the hives, and this is an inflammatory response to allergens. Now, antihistamines can be used to help reduce that histamine reaction or response that occurs with an inflammatory response. And with secondary infections, we have to be concerned about that due to scratching, and antibiotics can be used for a short period of time for that. We may see coal tar or corticosteroids used. Also, anti-irritants such as Aveeno and moisturizers can be used as well for this. Psoriasis is another skin condition. It's a chronic inflammatory disorder caused by abnormal growth of the skin and the vessels, and it is attributed to activated T lymphocytes, which produces cytokines that stimulate abnormal growth of the skin cells and the vessels. And it's characterized by remission and exacerbations. And exacerbations can be caused by infections or winter weather, certain drugs such as beta blockers or lithium, even stress has been attributed to it. Obesity and alcoholism has been attributed to it as well. And so treatment for this can be a combination of things. A coal tar can be used at night. Corticosteroids can be used. And then there's the newer drugs out for this. Also the oral retinoids, which is your vitamin A derivatives, and also the biological immunosuppressants that are, you studied about these actually in the past. And of course, those can suppress the immune system, as you well know, and can cause some serious problems for patients, but it's definitely seems to be working with individuals. As a matter of fact, there's some commercials out there these days about treatment for psoriasis. And of course, when we use an immunosuppressant, we got to be sure that we do good teaching and we check the patient out really good before they start that medication. This is another type of facial type of situation, rosacea, where there's fine red superficial blood vessels on the face is where you typically see this. Erythema, um, telangiectasis, which is the fine red superficial blood vessels there, and acne-like lesions of the face can occur. So some things that can cause this: spicy foods, heat, alcohol, and embarrassment can worsen that condition. Okay, bacterial infections, we want to think about or look at all these types of infections. We got bacterial. Cellulitis is something that we see commonly for sure in the area, in our area. I've seen that quite a bit in the hospital setting. It typically or can be actually MRSA. So cellulitis can cause symptoms like erythema, tenderness, and edema, and it can be localized and then spread to the subcutaneous tissue, and generalized malaise, chills, fevers can occur with this. And of course, if it spreads to that area, then they're going to have to be treated with something systemically to take care of that. And so that could be a PO antibiotic or an IV, depending on the extent of it. And also, you may see the ones I've seen in the hospital are actually having to get an incision and draining an IND to the site. So they'll have to go to surgery for a local procedure and a minor procedure, and where they actually drain the site that's affected or infected. And so we've been seeing quite a bit of this in the hospital setting for sure. Folliculitis is where hair follicles are infected, and it can be anywhere where there's hair. So the scalp, a bearded area on the face is where most common areas are, but it can happen anywhere. Funicles and carbuncles are infections usually caused by staph. Furnicles are like boils, or boils, if you will, and that results from the folliculitis, and they do tend to reoccur. You see them sometimes in the neck area of the face, in the axilla area, in the buttocks, thighs, or the perineum area. Carbuncles involve many hair follicles and can include multiple pustules. Carbuncles may cause fever, malaise, leukocytosis, and bacteremia. A lot of times the healing of the carbuncles often produce scar tissue. And then impetigo is a superficial skin infection, and it can be caused by either strep or staph. So have to watch that. You see this in pediatric kids a lot with around their nose area. They get a honey crusted, lesion on that area there. And then fungal infections, we have the oral candidus, which is also known as thrush, and that involves the mucous membrane of the mouth, and it often occurs with superinfections after the use of a broad-spectrum systemic antibiotic. It's also commonly seen with patients who are immunocompromised as well, especially our cancer patients who have been on chemotherapy. They a lot of times will get the oral candidias. And so you'll see, you may have seen this before with patients. They've had magic mouthwash where they either swish and spit the mouthwash or they swish and swallow, depending on the extent of the thrush. If the thrush is down, all the way down the oral, the throat and that area, then they will swish and swallow. Now, that magic mouthwash is a combination of drugs, but the main drug to treat the thrush is nystatin. So it is an antifungal and it works really good. So you may see this with different patients, especially those who are immunocompromised. Candidias can also occur in the vaginal area, the vulva area as well, due to systemic antibiotic use. Or it can, you may see this with diabetics too, because of the compromised immune system with them. The intrapterygo is where, and you probably have seen this, just never heard it called that, involves those skin fold areas where two surfaces are, in contact, like the groin or underneath the pendulous breast of clients, or in between skin folds of obese patients, that kind of thing. So that's a fungal infection. Tinea infections, also known as ringworm, caused by fungi, and these infections can involve the scalp, and it's called Tinea capitis. It can also involve the body, which is Tinea corpus, and it can also involve the feet, which is Tinea pedis, and also other areas. Now, Tinea pedis is also known as athlete's feet, and you've probably heard that before. So antifungals are used to take care of that. Let's see, and then of course the viral infections, we have two types of herpes simplex infections. The type 1, it usually involves the face or the neck area, like fever, blisters, or cold sores. And type 2 involves the genitalia area. And of course other herpes infections are varicella, which is the chickenpox, and then herpes zoster, which is the shingles. So we have antimicrobials that are available for topical, and example of that is Bactroban for bacteria, clindamycin for acne, Zovirax for viral herpetic lesions, ketoconazole for fungal infections. Now, your antimicrobials are used to treat acne, rosacea, skin infections such as impetigo or MRSA, and they can also be combination products. When used in dermatological infections, antimicrobials can be administered locally or topically, or systemically, oral or parenteral, depending on the extent of the infection. Topical antibiotics can also be used to treat superficial skin issues such as acne or any kind of infection there. Systemic antibiotics or antibacterials are used for soft tissue infections such as cellulitis and post-op wound infections. Now, tetracycline is used for acne and rosacea, and the fluoroquinolones, like your Cipro, can be used to treat the soft tissue infections caused by gram-negative organisms. Also, your sulfa drugs can be used for that as well. Topical drugs are indicated for mild to moderate acne, and of course adverse effects can include the very symptoms that you're seeing with the infection, so such as erythema. It can also cause peeling of the skin and dryness and burning, as well as development of resistant strains. So we know that can happen with antibiotics, and it can also happen with topical antibiotics. Oral antibiotics are the first line treatment for patients with moderate to severe inflammatory acne. And these drugs, of course, have the antimicrobial and anti-inflammatory effects, and it's usually given for around 6 to 8 weeks. So skin infections can be strep, staph, or MRSA, and are common reasons to use those antimicrobials. And of course, inappropriate use can contribute to resistance. Antifungals are used to treat the tinea or the candidias, and of course antivirals are used for shingles or any of the herpes viruses. Corticosteroids, again, we may see those being used as well, and of course, oral or injectable form, we know that has a systemic effect for sure. And they can help decrease the inflammation, so help with the swelling and the itching. It can, as you know, it comes topical as well, and we know that it can help with that redness and pruritus associated with dermatitis or any skin condition. So we got to manage those adverse effects with steroids. As you all know, you've had those before, so we got to watch for those. And we want to avoid the face area with corticosteroids unless it's been prescribed. We know that steroids thin the skin, so got to be careful with that, and places the patient at risk for injury there to the skin. Covering the site with an occlusive dressing increases the rate of absorption and increases the risk of systemic effects. So we need to think about that. And then taper the use if the patient has been on it a long period of time, because as you know, the adrenal gland, if it has been not working because of the cortisol being in the body due to the medicine, then it's might not turn back on. So we may cause adrenal insufficiency with that. So that's why we want to taper the medicine off to get that adrenal gland to kick back in. Now, if it ends with ONE, then it's likely to be a steroid. Prednisone is an example of that, and it's available in creams and gels. And remember about antihistamine creams like Benadryl are not steroids, they're antihistamine. But sometimes you'll see these creams as a combination. We also have the antiseptics that kill and inhibit growth of bacteria or viruses, and chlorhexidine is one of those that we should be familiar with. We use that in the hospital system. We also have those immunosuppressants as well that are out there. Now, they are not a part of your exemplars, but you have had them in the past. Just, knowing that immunosuppressants can cause lymphoma and reduce, our immune system, placing a patient at risk for infection. Those are the kinds of key things that you would need to remember about them. Now, topical agents with support for effectiveness include aloe and oats. Now, I think this is listed under your herbs. Of course, aloe is very effective in helping with burns, and oatmeal baths are very helpful with itching. Okay, so acne is what we want to talk about now. It's a very common thing, and it can be not caused by dirt. It's caused by hormones, blocked pores, and overproduction of sebum, and we can't wash it away. And for young kids, it can be very embarrassing and cause some self-esteem issues. Um, Excessive washing can worsen the skin condition, so we need to teach them about avoiding scrubbing or abrasives there. They need to wash twice a day gently. And there's some uh, different things that are used, combination treatments. The benzoyl peroxides help with the drying effect. We need to wash the skin with mild soaps such as Dove. And then there's agents used, the antibiotics, even aldactone used to help lower testosterone, and retinol products are used as well. If retinol is used, it increases the risk of sunburn, so we got to do great teaching with that. It is also a product of teratotoxic, so teratogenic. So we got to teach the patient about that. And we got to teach about certain medicines that can actually cause acne, such as steroids or lithium. Now, the retinoid is a vitamin A derivative, and so we need to think about that. If it is a vitamin A derivative, then we need to teach the patient about not taking supplemental vitamins, vitamin A, or they'll get the hypervitaminosis with that. But it acts as sloughing off the thickened, dead layer of skin and works to remove scars from acne. Again, got to teach the patient about the teratogenic part of this. And so if you have a childbearing age person that you're caring for, we've got to definitely document, check, do a pregnancy test, and a negative pregnancy test has to be present, and we have to teach about birth control methods. They even go into great detail in the textbook talking about an I pledge, where the patient pledges to use birth control while on this drug. So it's very important that we check all of that out. Because of the intense drying of the skin, they can get burning of the skin, and especially if they're out in the sun. So we have to teach about that, and then it can also cause a severe dry mouth. Also, corners of the mouth will crack, and of the eye area as well. So we need to avoid that area, and the lip area as well, and teach to avoid pregnancy and sun exposure. So our vitamin A or retinoid is the isotretinoin, and other medications that are used for acne can be the antimicrobial drugs. And let's talk about the retinoid, the isotretinoin. That is, of course, used commonly to treat acne. It can also be used for psoriasis. You may see it used for aging and wrinkling of the skin from sunlight exposure, and certain skin cancers as well. There are several adverse effects with this medication. Let's talk about those. Dermatological is the most common. Dryness and swelling of the lips, dry skin and mucous membrane, nasal drying. It can cause epistaxis or nosebleeds, dry mouth, conjunctivitis. It can cause peeling of the skin. It can cause skin fragility and rash and pruritus. Your GI effects can be nausea, vomiting, and even inflammatory bowel disease and pancreatitis, although that is rare. With musculoskeletal effects, it's arthralgia, myalgia, particularly with vigorous exercise, um, weakness. It can cause an increase in the creatinine phosphokinase, the CPK. It can cause back pain in some children and bone abnormalities. It can decrease the bone mineral density, and it can cause a premature epiphyseal closure for children. The metabolic effect, it can cause hyperlipidemia, and it can cause um, low density protein, so we can have some real problems with that. It can cause psychiatric effects such as depression, psychosis, aggressive or violent behavior, uh, suicidal thoughts and actions have also been reported with this drug as well. So we'll have to observe for signs and symptoms of that. Other effects: decreased night vision, also corneal opacities, hepatotoxicity, and bone marrow suppression. So lots and lots of side effects with this drug. So we certainly, want to be sure that we've got indications for this medication due to the side effects that goes along with it. Also, spirulactone, because of trying to get the hormones under control, might be used. You may see oral contraceptives used, and steroid use is associated with acne development. Okay, sunscreens. Of course, we want to advise patients, especially if they're using the retinoids, that they're going to be more sensitive to the sun. So we got to teach about sunscreens and wear protective eyewear and hydrate. Hydrate unless it's contraindicated. Many medications can cause that sun sensitivity, not only the retin-A, but also, several of our antibiotics can definitely cause that. So we need to be sure to teach the patient about this. And the other thing about teaching with sunscreen is to teach about reapplying ever so often. So they need to be sure to do that. Read the label, and it should tell them how often it does need to reapply. And of course, we always need to promote healthy skin. So there's some good teaching in your book about that, but we need to talk about, eating well, drinking plenty of hydration there if it's not contraindicated. Use sunscreen and protective clothing. Topical agents are not all created equal, so we need to, be sure to let them know about that. Avoid known irritants, harsh cleaners, latex, and avoid that scratching and itching. Try a cold compress. That's going to help with the itching, not a warm compress, but a cold compress. And we need to, talk to them about they can use that Aveeno and baking soda diluted in bath water to help with the itching. Okay, that concludes your podcast.